Hey everyone, welcome to The Explainer. I'm really glad you're joining me today because we're looking at a topic that is absolutely critical, yet honestly, it's still highly misunderstood. We're talking about the severe risks of malaria during pregnancy and exactly how to protect yourself if travel is just utterly unavoidable. If you or someone you love is pregnant and even considering a trip to a tropical or subtropical region, the official medical guidelines we're unpacking today are literally essential learning. So let's just dive right in.
It is without a doubt the most common question expecting mothers ask when planning a trip. Does being pregnant actually increase my risk of getting malaria? Well, the definitive medical answer is a resounding yes. You are significantly more likely to get malaria when pregnant. But, why is that exactly?
Think of it like this. When you aren't pregnant, your immune system operates with its standard infection defense. It's doing its normal job. But during pregnancy, your natural immunity to any infection is biologically lowered. Fact is, even women who normally live in a malaria risk area lose some of their natural immunity when they become pregnant. So what does this all mean for you? It means that not only are you at an increased risk of actually catching malaria, but you're also at a much higher risk of suffering a severe form of the disease, developing severe complications, or honestly, even facing a life-threatening situation.
To tackle this, here's our game plan. We're going to start with the hidden travel risks, move through the ABC method, awareness, bite prevention, and chemoprophylaxis, and finally, we'll cover returning home.
Section 1. The hidden travel risk. What it means for you and your baby.
While we just touched on the risks to the mother, the risks to the baby are equally severe. Look, there's no way to sugarcoat this. If you contract the Plasmodium parasite, that's the one that causes malaria, during pregnancy, you're at risk of suffering a miscarriage, a stillbirth, or going into premature labor. On top of that, your baby might not grow properly and could be born with a low birth weight. In very rare cases, if you have malaria right around the time of birth, your baby could even catch it directly through the placenta. The stakes here are incredibly high.
But there is a way to protect yourself if this travel is absolutely mandatory, and it boils down to a highly effective rule of 3 framework known as the ABC method. This is going to be your core defense strategy. A is for awareness of the risk, B is for bite prevention, and C is for chemoprophylaxis, which is really just the medical term for anti-malarial medication. Following these 3 steps correctly can drastically reduce those severe risks we just talked about.
Section 2. A is for awareness, understanding your environment. First up, awareness. Now, not all travel carries the exact same level of threat. Your actual risk of malaria depends heavily on the specific country you're going to, how long you stay, and even the time of year. For instance, traveling in rural areas carries a way higher risk than sticking to well-developed tourist spots. Sleeping outdoors or in rooms without screens, far more dangerous than staying in an air-conditioned hotel. And traveling during the wet season is going to significantly increase your exposure compared to the dry season. Knowing your specific environmental risk factors is absolutely step 1.
Section 3. B is for bite prevention. Guarding against bites 24 hours a day.
Get this, you might be surprised to learn that pregnant women are actually more attractive to mosquitoes. I know, right? It makes this step absolutely critical. So, what can you safely use to repel them? 50%. That is the magic number you really need to remember here. Expecting mothers can safely use insect repellents containing up to 50% DEET on uncovered skin. DEET has been used for a very long time, and the medical guidelines are super clear. It is entirely safe during pregnancy and while breastfeeding. Just remember the golden rule. Always apply your DEET after you've put on your sunscreen, and definitely reapply it more frequently if you're out sweating in the heat.
But look, DEET is just one piece of your 24-hour armor. Let's talk about the rest of your essential bite prevention checklist. If you're sleeping in a room without screens on the windows, you absolutely must sleep under a mosquito net treated with an insecticide, like pyrethroid. Make sure it doesn't have any tears, and tuck it tightly right under your mattress. Keep in mind, evenings and nights are the real danger zones, so after the sun goes down, cover up. Wear long sleeves, long trousers, loose-fitting clothes, and socks. The color of your clothes doesn't really matter, but the coverage sure does. Whenever possible, sleep in cooler, air-conditioned rooms. And at night, it's highly recommended to vaporize synthetic pyrethroid tablets using a plug-in heater, which is much better than those standard smoky mosquito coils.
Okay, I want to pause right here for a second because this next point is vital. Herbal or homeopathic remedies do not protect against malaria. Period. Please do not rely on natural remedies when the health of you and your baby is literally on the line. They are completely ineffective against malaria-carrying mosquitoes, and the medical guidance states they should simply not be used as a preventative measure.
Section 4. C is for chemoprophylaxis, anti-malarial medication. Let's demystify that big, clunky medical word right away.
Chemoprophylaxis simply refers to taking prescription anti-malarial medication to prevent an infection. That's it. But the real key to this step is the timeline. You generally have to start taking the medication a week or more before your journey even begins. Then, take it continuously during your whole trip, and, this is crucial, you have to continue taking it for up to 4 weeks after you leave the malaria risk area.
Which brings us to this incredibly sobering quote directly from the clinical guidelines. The most common reason for getting malaria is not taking the medication correctly. Think about that. Antimalarials are amazing, but they aren't 100% foolproof. Failing to follow that strict timeline, skipping a few tablets here and there, or stopping the medication the second you step off the plane to go home, that drastically increases your chances of getting sick.
Now, not all medications are created equal, especially when you're pregnant. The antimalarial drug usually recommended for expecting mothers is called mefloquine, mostly because it appears safe to take during pregnancy. On the flip side, drugs like doxycycline and primaquine are strictly not recommended. They actually have the potential to harm your unborn baby. And keep in mind, if you're in the first 12 weeks of pregnancy, if you're breastfeeding, or if you have a history of conditions like epilepsy or depression, well, mefloquine might not be an option for you either.
And that is exactly why you need to have a structured one-on-one conversation with a medical professional. Ask your healthcare team 3 really simple questions. What are my options? How do I get support? And what are the pros and cons for me specifically? Medication choices depend heavily on the exact country you're visiting, because parasites actually build up local drug resistances over time, and it depends on your own unique medical history. Oh, and never buy these medications over the internet. They could be entirely fake. Always get them via a real prescription.
Section 5. Returning home safely. Standby treatment and long-term vigilance.
Because the danger doesn't just magically disappear the moment you unpack your bags. If you are traveling to a really high-risk area where you might not have access to good medical care, your doctor might actually give you emergency standby treatment to take with you in your suitcase. You need to start this standby treatment and seek immediate, urgent medical help if you develop a flu-like illness and your temperature hits 38 degrees Celsius or above.
And you must maintain long-term vigilance once you're back. Malaria is a surprisingly sneaky disease. Symptoms like severe fatigue, headaches, muscle pains, vomiting, and even jaundice can take a full week or more to show up after a bite. Occasionally, it can literally take up to a full year for symptoms to finally appear. So if you get a sudden, unexplained fever up to 12 months after returning from a high-risk country, you have to tell your doctor immediately about your travel history.
Which leaves us with this final, incredibly important question, straight from the medical guidelines. Is your trip truly essential? The primary medical advice across the board is crystal clear. Do not travel to a country where malaria is common if you are pregnant, period. But if the trip is absolutely unavoidable, well, you now have the ABC toolkit. You've got awareness, you've got strict bite prevention with 50% DEET and treated nets, and you've got proper chemoprophylaxis. Use them all to give you and your baby the very best possible protection. Thank you so much for learning with me today on The Explainer. Stay safe, stay informed, and I'll catch you next time.